Hello guys, welcome to my 10. So in this video we are going to discuss about the anatomy of the PortoCaval Anastomoses. So what is the PortoCaval Anastomosis? It is nothing but as porto means portal vein, and then they are anastomosing with the caval, which is nothing but as the systemic veins, which will drain into the inferior vena cava. So anastomosis between the portal vein and the systemic veins is known as the PortoCaval Anastomosis. So there are many sites in the abdominal cavity where anastomosis exists between the portal and the systemic venous systems. These communications between the veins of the portal and caval systems form important routes of collateral circulation. They form the important routes of collateral circulation during portal obstruction. Portal obstruction. So whenever we have portal obstruction, we find an important chain of circulation to the systemic veins. So what are the important sites of the PortoCaval anastomosis? This is a very important question in university exams. Important sites of the PortoCaval anastomosis. Firstly, we have the umbilicus. So coming to the umbilicus, here the left branch of the portal vein will communicate with the superficial veins of the abdominal wall. We have the right and the left branches of the portal vein, right? So the left branch will communicate with the para-umbilical veins. Para-umbilical veins which will drain from the anterior part of the abdominal wall. So left branch of the portal vein will communicate with the para-umbilical veins of the anterior abdominal wall. This is the portal vein and these are the systemic veins. So in any case of the portal obstruction, these para-umbilical veins will become distended and tortuous. They will become distended and tortuous like this upon the portal obstruction, and this clinical significance, this is known as the caput medusae. Caput medusae, because they look like the head of the Medusa on the Greek gods. So upon portal obstruction, the anterior abdominal wall veins, which are known as the para-umbilical veins, they will become distended and tortuous to form the caput medusae. Come to the second site of the PortoCaval anastomosis, it is nothing but as the lower end of the esophagus. Lower end of esophagus. So here what happens? The lower end of the esophagus is draining into the left gastric vein, right? The left gastric vein is the portal vein. The left gastric vein will drain into the portal vein, and then we have the lower esophageal tributaries which will drain into the hemiazygous vein. This is the lower end of the esophagus and they will drain into the hemiazygous veins. Hemiazygous veins which form the systemic veins. So the portal system is the left gastric vein, which and the caval system is the hemiazygous vein. The anastomosis between these two form the anastomosis around the lower end of the esophagus. In portal obstruction, as occurs in the liver cirrhosis. In liver cirrhosis, portal obstruction occurs. In this what happens? These collateral channels will become distended and tortuous. They will form the esophageal varices. Esophageal varices which may rupture, causing hematemesis. So during PortoCaval obstruction, these veins will become distended and tortuous to form the esophageal varices, which will result into hematemesis, which is nothing but as vomiting of blood. Vomiting of blood, and it may lead even to death. So this forms the important PortoCaval anastomosis. Coming to another important channel, which is around the anal canal. The third important site of the PortoCaval anastomosis is the anal canal. So what happens here? Here the superior rectal vein. The superior rectal vein will ultimately drain into the portal vein, and then it will anastomose with the middle and the inferior rectal veins. It will anastomose with the middle and the inferior rectal veins. So this forms the systemic venous channel, this forms the portal venous channel. The anastomosis between these two will form the PortoCaval anastomosis. So the distension and dilatation of these anastomotic channels will result into hemorrhoids. So anything during portal obstruction, distension and tortuous of the middle and the inferior rectal veins will result into hemorrhoids. It will result into hemorrhoids. So these are the main three anastomosis between the portal and the systemic venous systems. So coming to revising it once again, what are the sites of the anastomosis? We have the lower end of the esophagus, and then we have the umbilicus and the mid-anal canal. And what are the veins forming the PortoCaval anastomosis? In the lower end of the esophagus, we have the left gastric vein and the esophageal veins, which will drain into the esophagus vein. In the umbilicus, we have the paraumbilical veins and the superficial veins of the anterior abdominal wall. In the mid-anal canal, we have the superior rectal vein and the inferior and middle rectal veins. And what are the clinical signs? In the lower end of the esophagus, we have the esophageal varices leading into the hematemesis. In the umbilicus, we have the caput medusae sign. In the mid-anal canal, we have the hemorrhoids. So this forms the PortoCaval anastomosis. Thank you guys. Thank you for watching the video till the end. Please make sure to subscribe and hit the like button, and also share it to other friends and people. Thank you so much.